will discuss about the treatment of the HIV. So, we first of all, for the treatment, we need to test for the detection of HIV. For the detection of HIV, what kind of test do we need? We need blood tests, nucleic acid tests, and we need antibodies test. In antibodies, we will check that the antibodies test will show us that our immune system is working properly or not. If our immune system is not properly working, so it means that HIV is in the body of the person. So the last test that we need is the saliva test. Through this, we can recognize that how many antibodies our body is making. Basically, there is no cure for HIV. There is no cure present for HIV, as we are having the example of AIDS. AIDS is the type of HIV, but we are not having any cure for AIDS. So we are having no cure for AIDS, but there are some drugs that are working against of HIV. What are the name of those drugs? Those drugs are Discovery, Leucobix, Curaclace, these three are used for the treatment. Actually, these drugs are used in the medicines. Those are working against of the HIV. These three are the names of the drugs. What are the function of these drugs? These three drugs inhibit the activities of enzyme of virus. They stop the viral enzymatic activity inside the host cell. So these three are working against of these up. So the conclusion was that there is no cure for HIV, but there are some drugs, those are working against of the HIV. Those are just doing that, the work of those drugs are that they are just inhibiting the viral enzymatic activity inside the host cell. Now let me discuss about the transmission of HIV, that how does it transmit to the host cell. So HIV can be transmitted from the blood transfusion. For example, if someone is having HIV, a patient of HIV, this is a patient of HIV, and the bleeding is going from his hand, and somebody who is safe from HIV come and he shake his hand with that one person, from the blood is circulating, so the disease can be transmitted through this one technique. Then the second we are having is that from the exposed wounds. Those wounds of the patient, those are not properly cured. That can be reason of the transmission of the HIV. Then the sexual interconnection, it is one of the main cause of the HIV. Then we are having urogenital fluids. Urogenital fluids, basically these two are interconnected with each other. Then we are having placenta. It can acha, virus can, the HIV can be transmitted from placenta and fetus development into the baby. If the mother is having the disease of HIV, so it can easily be transmitted to the baby. Then we are having that breastfeeding is the most common way to transmit the disease. And if we talk about the precautions, because there is no cure, but we can follow the precautions, because precautions are better than cure. So we can avoid the unsterilized syringes. Those are used. We can say that we have to avoid those syringes. Those are not in the use. They were in the use. Then we have to avoid the sexual contact. These two are the precautions, and these are the ways through which HIV transmit to the patient. The number first one causes the blood transfusion. Then number second one is exposed wound. Then we are having sexual interconnection and the urogenital fluids, and the fetus and placenta development, and then breastfeeding, and we are having after that precautions.